So we have to make the tissues prepared to take the energy which is being emitted from the QR devices. So for that basic thing, so example, if I'm treating a spine patient, so typically the patient will be having either the degenerative disc diseases or the prolapse. So the treatment protocol is very simple here. So first, tackle the pain, make the patient rest for some time. Then we'll go for a decompression therapy, followed by the third or fourth day, we'll be starting the magnetic resonance therapy by making the patient lie down inside a machine, a small quiet machine for 1 hour per day for next 9 days. So with this 9 days, the regeneration of the disc cells will be started. So this is a typical treatment protocol for any spine degenerative diseases. Now coming to the knee joints. So knee joints, we need not wait for some time. So we can start from the day one itself. So depending on the condition, we can start 7 days or 9 days, 1 hour per day. And for the shoulder, we can straight away start. We need not wait for shoulder as well, like arthritis of the shoulder, frozen shoulder, or any tendinitis or any tear, ligament tear. So we can start treating from the day 1 hour per day for 7 days or 9 days. And along with this one, we have to add some nutrition supplements or make the diet stronger, as well as to add some exercises which actually benefits in strengthening the muscles and moving the joint and spine very easily. And ankle, same thing. So ankle, any ligament injuries, we can start treating from the day 1 for 7 days or 9 days, 1 hour per day. So typical QR sessions or QRST sessions will last for 1 hour, that is 60 minutes per day. So we will divide the 60 minutes again into 3 parts. So every 20 minutes, there will be change in the amplitude and the frequencies of the waves. So by this, the protons will be aligned in position and there will be always a infusion of the energy inside the cells. And every 9 hours is not same. So every 9 hours, there will be different amplitude and frequency, and every 60 minutes, 20 minutes, we'll be changing the amplitude and frequency. So typically, depending on the condition, we can treat for 7 days or 9 days, depending on severity as well. And this is in first instance. When we go for repeat treatment, we can always repeat after a year or 2 years. Sometimes we can repeat even after 4 years. So that time we need not treat for entire 9 days or 10 days. We can always reduce to 6 or 7 days. We can reduce it off. Yeah, certain, because this is directly is an electromagnetic field. So we don't want certain metals to be present in and around the bodies. Example, any metals like chain or something, or main contraindication what we usually do is a pacemaker. So pacemaker is a typically electronic device which is inside the heart, which makes the heart to beat. So that may interfere with our magnetic field and the patient may get uneasy with that one. And in other certain conditions, such inflammatory conditions like active rheumatoid arthritis or any inflammatory disorders, we are not supposed to treat. And other contraindications are any cancers, tumors or cancers where we don't know. Actually, we don't have much studies on how the cancer cell will take the energy. So we are not supposed to treat in suspected CA cases or tumors. It actually favoring all kind of physical therapies what we are giving. So because of reduced downtime of regeneration and because of increased regeneration of the tissues, the therapy will be faster and the patient will be more actively taking, and they can be back to the normal exercise mode very quickly. So this is actually augmenting all kind of short cases like tendon injuries, arthritis or the slip disc very fast. And certain cases, example, when we have a massive tear of the ligaments or the muscles, we usually go with surgical aspect. So we try to repair. Example, we repair shoulder with arthroscopy or the knee ligaments with arthroscopic repairs. And we usually give at least 2 to 3 weeks of time to reduce the inflammation. Then we start with the NMR for 7 days or 9 days, which actually enhances the healing and make them sport back very fast. So in both the ways, with surgical or non-surgical modalities, it is actually helping in regenerating very fast and reducing the downtime.